think the biggest myth about bisexuality is that we don't exist.
My bride is restless. She waits for a day and a twist up.
I began to identify as bisexual when I was 12 years old. I had a dream that just sort of told me that that's who I was, and it was a very sort of exciting revelation. When I was 9, I actually came out as a lesbian, and I had a journey through that to recognize that I liked boys just as much.
Without compromises, she's full of surprises.
It is estimated that there are 8.8 million gay, lesbian, and bisexual persons in the U.S. Researchers have found that bisexual women fare the worst in health when compared with heterosexuals, gays, and lesbians. They were more likely to be victims of intimate partner violence, had high levels of depression, and engaged in binge drinking. The state of Massachusetts has taken the lead in addressing these issues.
In the analysis that we did of the Massachusetts State Behavioral Risk Factors Surveillance Survey System data, we found that bisexual women had poor health profile in multiple domains of health. And that was in terms of access to health care, mental health, substance use, and chronic health, physical health-related outcomes. So it seems like there is something systematic going on that's different for bisexual women that increases their risk of having these poor health outcomes.
I do think social stigmas play a part in bisexuals having mental health issues. If people are telling you bisexuals don't exist, you're just waiting to come out all the way, or, oh, you're just experimenting, can be very devaluing and cause a lot of stress, depression, anxiety.
I think that people who identify as bisexual are under a great deal of social stress due to invisibility and due to the negative stereotypes about bisexuals. There are people who sexualize your identity and think it's all about sex when that's not what you're saying. There are people who assume that you're a swinger. So many assumptions made about you, so I think a lot of people are afraid to identify as bisexual because the response is usually not good.
I had one very bad experience, actually, where a gynecologist, I was actually asking to be tested for STDs, which is just a normal routine, wanting to make sure everything's good for myself and my partners. And she became very upset when I told her that I actually had more than one partner, I identify as polyamorous, and yelled at me and told me I should, it's not only about sex and that I should get married and all these things. And it was really distressing because I was being responsible about my sexuality and I wanted to talk to her, and I wasn't able to really do that.
When health providers don't understand bisexual issues, the danger is that the bisexual client, first of all, may have a bad experience and not come back and not go elsewhere.
I definitely ask all my patients about their sexual identity, orientation, sexual concerns, sexual functioning. When I was in training, there was absolutely no training given or education about sexual diversity. In fact, there's a recent survey of both doctors and nurses across the country that showed that 30% of doctors and nurses, in quotes, feel uncomfortable taking care of patients who are bisexual or gay.
I think one of the best things that we can do to improve bisexual health is to talk about bisexual health. The book Bisexual Health, which was published in 2007 by the National Gay and Lesbian Task Force, was the first book of its kind to come from a national LGBT organization. I found in researching for the book was that a lot of data was collected on bisexuals, but then not reported on. It was just one LGB piece of information, and you really had to dig to separate the B out of the LGB. And nowadays I see a trend towards researchers doing that more and more often.
The state of Massachusetts was responsible in putting a question about sexual orientation on the state behavioral risk factors surveillance survey. Only a few states right now have included a sexual orientation identity question in their surveys, and that will allow us to look at variability across states and will allow us to evaluate the impact of different social policies on people's health and changes in policies over time. In fact, people are more likely to answer a question about their sexual orientation identity than they are to tell you their income.
We are simply talking about getting information vitally needed to protect the health of all Americans, including LGBT Americans.
Recently, Representative Tammy Baldwin, a Democrat from Wisconsin, introduced a Health Data Collection Improvement Act, H.R. 6109, a bill that would improve the healthcare system for LGBT Americans by allowing the Department of Health and Human Services to collect voluntary data on sexual orientation and gender identity.
There is so little research being done by federal and state entities about any kind of LGBT issues. I mean, we really are pretty much an ignored population. And any research that is being done is usually done about men and HIV, which is an important field, and I don't want to even suggest that shouldn't be done, but there is not much attention at all toward women, and particularly toward lesbian and bisexual women.
Bisexual women can catch every type of sexually transmitted infection. I think when we try to figure out if they're more prone to certain infections, that's difficult because every woman's different and her intimate relationships are different. But, risky behavior and unsafe sex certainly can make bisexual women more prone to certain infections, trichomonas, hepatitis, herpes, and chlamydia and gonorrhea are in that group of infections that we see.
I think there needs to be a focus on bisexual women's health. For one thing, for people who are interested in health disparities in relation to sexual orientation, it's very important to focus on who's kind of at the bottom of the barrel. Heterosexuals tend to have the best health, gays and lesbians are in the middle, and bisexuals are down at the bottom. There are a number of studies that show that there are as many people who identify as bisexual as there are people who identify as gay and lesbians, which means that 50% of the LGB population is B. So the bisexual health crisis, if you will, is actually very significant. We're talking about half of the LGB population experiencing significantly poor health.
I'd like to see materials about bisexuality in therapists' waiting rooms, in campus LGBT offices. A lot of people think that bisexuals aren't there, but we are there, but we're not being mentioned, so people think we're not there, and it just feeds into this circle of invisibility.
Culturally, there's still a real lag in accepting that women can be bisexual, and they don't have to be either gay or straight. And so that's complex for a lot of humans like us to understand. The spectrums are harder to understand than the boxes.